Can you do it again?
Yeah, I'm putting it here.
Put it on the chat.
773.
Put it on the chat.
Okay.
712.
Okay, guys.
This is Moderna.
Hey, Bill.
Yeah.
I think we're live. So we are live, and I do apologize for that. I guess technology is not my thing when it comes to what we're trying to do, but you can go ahead and start the meeting and call it to order. And
All right. Well, I'm going to call the April 8th, 2021 meeting of the Skokie Board of Health to order. And I'm going to read a statement as required. Until further notice, meetings of the Board of Health will be held electronically, with a majority of the members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie with the Skokie Department of Health, and all properly submitted statements or questions will be presented and read during the portion of the meeting. The comments can be emailed to publiccomment@skokie.org by mail. Village of Skokie, attention, Mike Charlie, Director of Health and Human Services, 5127 Oakton Street, Skokie, Illinois, 60077, or via the village's Dropbox located by the public entry to the Village Hall. And question for Mr. Charlie, do we have any citizen comments so far?
we had none.
Okay. Well, you have received the agenda and the minutes from our March meeting. And as we've adopted a consent approach to this, are there any items anyone wishes to extract? Seeing none, then the consent agenda and the minutes are accepted as published. Thank you. And the next thing on the agenda is my report. We've switched a couple things around. Mr. Charlie's going to consolidate his report on COVID and also the director's report in one item. So, Mike, could you pull up my my presentation?
Sure.
I'm glad to see Dr. Lynn's joining us. I know he had several conflicts this evening too. A question for the group. Does anybody know what is being recognized this week in April? What are we celebrating?
Public health.
This is National Public Health Week, April 5th through the 11th. And I thought it was something that we should recognize at this meeting. And if you could go to the next slide. The American Public Health Association has as a theme for this National Public Health Week, building bridges to better health. If you could go to the next item. The areas that they are emphasizing are, first of all, strengthening community. And I think we're really seeing that now in the midst of this pandemic, where it really is the community pulling together to get us through this. You're hearing stories every day on the news of people that are going the extra mile to support their community. Another topic is advancing racial equity. This is, again, a topic that has been highlighted during the pandemic in terms of the disproportionate impact that it has had on people of color or homeless in both the disease impact, but also availability to the vaccines. Justice. And this is something, Dr. Drackler, you've emphasized for years in terms of importance of recycling and the impact that has on our climate. The other item is building COVID-19 resilience. And I'm thinking this in particular, our discussion that we had last month about this idea of people who question the of taking the vaccine, and instead of presenting it in the negative, talking about in terms of COVID acceptance. How do we really build the acceptance of this through the community where there might be some resistance? Next slide. Something we're going to hear a little bit more about tonight, uplifting mental health and wellness. Again, I think we're aware that this has been a strain, especially on kids out of school, out of their social networks. but also just what has happened with people that are isolated. So we're going to have a presentation from Turning Point Health tonight. Elevating the essential and health workforce. And again, recognizing that those folks who are in the grocery store, that the people that clean the hospitals and clinics, they are essential to our function. And then finally, rebuilding. Less than 3% of the U.S. Health spending is on public health. Now, that may be changing with the bill that has been signed in terms of getting more money out to the public health community. And Mike, I don't know if you have something to talk about that in your report, but some $90 million is coming to the state, and some, I think, $30 million to Chicago. But something that we all know in terms of preventive medicine, investing in public health saves lives. And hopefully this pandemic will really make our leaders, our congressional leaders, our administrative leaders realize that it's worth spending money on public health. So if you could go on to the next slide. I just wanted to share this with you. I've been volunteering. Pat, you've been volunteering. Ed, you've been volunteering at the COVID clinic. It's such a rewarding experience. And these are just a couple pictures off the village's website. But you can see our one of our volunteer nursing students from Oakland Community. North Park also has had students. And the happy recipient of a COVID vaccine with thumb up. And again, I'm referring to the clinic now as the happiest place on earth, more so than Disneyland, because people are just so grateful that they are getting this protection. And then people have asked me, well, how much is this going to cost me? And I say, this is free. So it's an incredible gift. Here are some more patients and our nurse volunteers, nurse student volunteers. So it's just been a great experience, and I just wanted to thank everybody. And if you have a chance to visit one of those clinics, it's well worthwhile. And as you heard earlier, it really has been moving very smoothly and without a minimum of hassle for folks. So that's the end of this presentation. A question that I had posed to Director Charlie in that when I've been volunteering, I'm finding the little vaccination cards, those CDC cards. Some people drop them on the floor, and they don't put their name on it. They don't put their birth date. And my question was, if somebody drops one of those or they lose it, it's destroyed, how can they really find out and get the verification that they've been inoculated? Because that may become an issue in terms of getting on an airplane or being able to travel overseas. And Mike, I think you've got some good news along that line.
Yeah, so as soon as we vaccinate people, the information from their vaccination gets uploaded directly into the state of Illinois iCare system, which is the state vaccination database. And as a health department, we have access to those records. So if a resident loses their card, and the health department's been doing this for years now, that if you lose a vaccination card, for a nominal fee, I think it's like $5, and it's really just for processing and getting the card together. People can come in if they lose their card, and we'll produce a new card for them. So, and I know you and Bill, me and Dr. Warner spoke briefly about the whole passport thing too, Bill. And I don't know if that's something you wanted to discuss tonight, as to whether or not, the state was considering creating some sort of technology where people could actually open an app and show that they were, verify that they were vaccinated at businesses and venues and festivals. But from what I heard on the Monday webinar from Dr. Ezike, is that she's working with the state's Do It program, which is like the state's technology program, to possibly do something. But they're working on the technology, and it may be something that's available at some point to people that are vaccinated. And for businesses, it would help them too, because occupancy limits are currently if you're vaccinated, it doesn't take into doesn't consider vaccinated people in the total amount. So if you had, even though like restaurants, it may be a maximum of 50 individuals at a single restaurant based upon how the seating is set up or another venue, that only counts people that are unvaccinated. So you can actually have more than 50 people if everybody's vaccinated. So, which is a plus for businesses too. So.
What I've been advising people is to take a photo of that card on their phone, so at least they have another record besides the paper record. Because today I saw some pretty tattered cards for people who are coming back for their second vaccination. So it's not durable, and I understand when people try to laminate it, sometimes the print gets smeared. So their technology may be the answer, but there certainly is some resistance to that in society. Ed?
Yeah, this has been an ongoing discussion we've had with the health authorities, and clearly these cards are unreliable. You know, they can't be officially used for any purpose because they're so easily forged and copied and things like this. But what we could maybe suggest, Mike, is I know that I received as kind of a gag gift from my family, but the little plastic holders that many people put their IDs in, that they dangle from their their lavaliers, whatever you want to call the necklaces that people wear. Those plastic ID things is perfect size for that card. And people can put it in it, and then it doesn't get smeared. It doesn't have to be laminated. It can be updated. Because, we right now we're thrilled to get 2 doses, but around the corner we may need a third, or, and so that may be reassuring to some people. But we need an electronic solution to it.
The final thing that I wanted to mention was last fall we talked about getting some sort of public service announcement out about bicycle safety, and in particular wearing helmets. We put that on hold because with the this is what I wrote up last fall. It would have, if we decide that this is something we want to pursue, we'd have to change the first paragraph, because I wrote that when people were beginning to ride their bikes in October and November. But the bulleted areas, I think, still are pertinent. So is this something we think we should go ahead and pursue, see if we can get this posted with some revisions on the Skokie e-News as people are getting more active with nice weather? Ed?
Since I kind of brought it up at that time, I still feel quite impassioned about this, and it's really a perfect time to discuss it, Bill, because this past week the weather has been really delightful this past weekend, and I've seen lots of cyclists and lots of kids without helmets. And I just think that we don't have to debate the epidemiology. They are very important and they work.
Yeah.
And I realized that maybe last summer, fall, there was a shortage of helmets because there was a shortage of everything related to bicycling. But I think we have to remind the adults in the community, of the requirements, and to remind people about, cycling safely, because, it could be a great thing to do, and, especially, the fact that this type of recreation is probably here to stay for a while, because we're not sure about how things are going to be opening, or if the opening is going to be sustained. And Mike, this was right when you first came on board, I think, or possibly before you came on board. And I don't know if there's ways of exploring whether or not we can tie into companies to try to get low-cost helmets, or best yet, if we can even get donations of free helmets or certificates or things like this to help people. I was just commenting to Bill today that I wandered into Costco and they were selling really nice helmets with the MIPS safety requirements, which is kind of state of the art, for $29. And obviously Costco does do that kind of stuff, where they probably give things away to make you feel good about your membership payment. But the reality is it would be nice if we can help people who think that the cost may be a barrier.
For the Bike on Ridge, every year, the police department gives out helmets to kids. I don't know if our police department would be interested in doing that.
Thinking about the Evanston event,
Yeah, in the fall, the Bike on Ridge.
I'm speaking off the top of my head. I think May is Bicycle Safety Month. That might be something to see if we can work with the police department around. If there are any safety events, again, done safely from the COVID point of view. And it might be a great idea for businesses if they want to contribute to providing helmets. I know that Trauma Service at O&M Sonic did this several years ago for the kids in the neighborhood, the Lakeview neighborhood. Had a safety reminder time, and then also gave out helmets. So, Mike, this is probably something that we can work on offline.
Yeah, I like all the recommendations. I think for sure we can get something in an e-news. That's not going to be a problem at all. The research on the helmets, I think, in my previous position, we did a lot through the police department with, because they were the ones out and about and seeing the kids. And, you see a kid without a helmet, maybe you give them a coupon for a free helmet, or maybe you provide them some information as to like an event going on, or, so the police department did right. The police department sold bikes, that were found. So yeah, maybe working with the police department would be a good idea, and I can loop in Chief Baker and his team at the police department for sure.
yeah, I'm aware of 2 vendors in Skokie that are, popular bike sports. I don't know if LL Bean is still in the bike selling business. They were for a moment. But there are 2 others, and we can talk about who they are, and maybe we can even approach them and see if they have any ideas.
All right, well, that's the end of my report. Director Charlie, do you want to present your?
Of course, yeah. Let me just pull it up and.
Mike, you're muted.
Yeah.
Okay, hold on. Hold on. Okay, hold on. It's hard doing. I have this like one little screen on my podium I'm trying to do it. Thank you for that. Share screen. This screen. Share. Oh my Lord.
It's up live.
Okay, got it. Okay, so tonight I'm going to talk a little bit. I'm going to mostly talk about COVID. Really, that's a majority of what we're doing in the health department, and I think it's probably something that most of you are most interested at this point. So I'm going to talk a little bit about updated data, talk a little bit about CDC interim public health guidance for fully vaccinated people. I'm going to talk a little bit about variance. I know that we had talked about that at one of our last meetings, but just provide some updates, and then see if anybody has any questions. I know that Dr. Vernon and Dr. Lynn and some of the other members of the Board of Health certainly can weigh in on that also, and then just provide some vaccine updates regarding COVID. So our website does have a ton of data and information on Skokie residents, the Skokie community. As of the 6th, we are at about 5,876 total COVID cases, 122 deaths. Our 7-day moving average has actually gone up a little bit the last couple of weeks. We sort of saw that peak in November. It came back down, which was great news, and now it's gone up a little bit. Our positivity rate is at 2.71%. Just for some reference, the Cook region positivity rate, which is Cook County, without the city of Chicago, is at 4.2%. This is just, there's two different charts here. The chart on top represents the positivity rate in Skokie since the beginning of March, more or less. And the bottom one represents the Cook region. So we saw a period of time with a positivity rate between like January 1st through maybe the end of February, where everything was kind of on the decline. But we have seen a slight uptake in positivity rates. I've heard the governor's office and the state health department say that the 20-year-old age range is where they're seeing a lot of increase in cases. That's the age group which they just aren't wearing the masks, they're not social distancing, and of course that's something that's still strongly encouraged. Again, a comparison between the village of Skokie and the state of Illinois in regards to number of cases since the onset. I'm not sure if I shared this last time, this comparison, but if you look at it, it's eerily similar in regards to the trends. The top part, you not only have the number of cases that we had per day in Skokie, but also that orange squiggly line is a 7-day moving average. And as you can see in November, we had, if you can read that, I know it's probably small, but that's when we saw the largest number of cases, and it's slowly but surely came down, and we're at a point where it's sort of leveled off, but it's certainly lower than it was back in November. Talking a little bit about the interim public health guidance, just something that was new within the last week or so. The CDC has said that fully vaccinated people don't need to get tested, or they're not recommending testing now. If you recall, there are certain foreign countries that are going to require testing prior to travel within 72 hours, but at least domestically, the CDC is now not recommending that people are tested and or people self-quarantine after travel if you're fully vaccinated, which should give people that are vaccinated a small, a peace of mind at least when they're traveling, but you still have to mask and do some of the other things. They still recommend self-monitoring and masking. However, if you're not vaccinated, they're recommending that people get tested 1 to 3 days before travel and quarantine after. In the county of Cook, they recommend that too. In the city of Chicago, they're a little more restrictive, and they're requiring people to quarantine after travel. But I'm not really sure how they're enforcing that. It's more of a recommendation, I would think, although it is technically a requirement. Some of the other things, I can't remember if I mentioned this to you guys, to the Board of Health last time, but the CDC maybe about a month ago updated some guidance for fully vaccinated people, essentially saying that if you're vaccinated and you're visiting a single other family, nobody has to mask. But if you're vaccinated and you're in a group setting, you still have to mask. And they say that you don't have to quarantine or test following a known exposure as long as you remain asymptomatic. And that comes into play if we have in the contact tracing, where if you come into contact with someone and we say, who's your close contact? And they say, it's this person. And we call that person, they say, I'm fully vaccinated, which means 14 days after their final dose of vaccine, then we won't require that they vaccinate, but they just monitor their symptoms. And if they do become symptomatic, obviously they'll quarantine and test. Some other recommendations, including, in areas where you're visiting unvaccinated people who are at increased risk of severe COVID-19. So, certainly if you're visiting someone on a long-term care, you got a mask, even if it's a single person. If you're visiting someone in the hospital, if you're visiting someone who's going through cancer treatments, you really have to use common sense with that and mask, even though you're vaccinated. Only when you're visiting otherwise healthy people. We did talk about variance a little bit, but since this is what I presented to the village board on Monday, I thought I would walk through it. Certainly a variant, as most of you know, is a mutation of the existing virus, right? And it changes the virus's characteristics, good or bad, and usually for the bad. And it essentially makes the virus act differently. How does the Illinois Department of Public Health test for variants? Well, what people may think is that every single test gets tested for a variant, which is far from the truth. What it is IDPH is asking that hospitals and commercial labs enrolled to participate in the Illinois Variant Surveillance Program. And what happens then is the labs are asked to send 10 randomly chosen SARS-CoV-2 positive samples weekly to IDPH for genomic sequencing. So when you do see the state numbers, people may say, oh, that's it? Well, there's probably more than the state is showing in the data, just simply for the fact that they're not testing every sample, every test that is completed. The CDC and the federal government have shared that there are variants of concern that have evidence of increased transmissibility, more severe disease, significant reduction in neutralization of the antibodies generated during a previous infection or vaccination, and reduced effectiveness of treatments or vaccines. For example, this B117 variant, its known attributes include, approximately 50% increased transmission, likely an increased severity and minimal impact, but it does have minimal impact on monoclonal antibody therapeutics, which is actually a good thing. In regards to variants of concern, they say there are 5 of them in the U.S. right now. The B117 from the UK, the B1351 from South Africa, the P1 from Brazil, the B1, then the B1427 and B1429, which were originally identified in California. In regards to numbers, the top part of that is 3 of the variants, and I pulled this directly off the CDC website, at least the United States cases. The Illinois cases are actually directly off the Illinois website just because it's updated more often and it shows a more accurate depiction. As far as we know in Skokie, we've had 1 resident with the P1 variant. For that one, they contacted us and they just said, hey, just to let you know, we had a Skokie resident with the P1 variant. The bottom map is actually from Monday, and it just provides the fact that I'm guessing Oklahoma just isn't sharing data at this point. I'd be very surprised if there's none there, but it's possible, I suppose. But in general, the B117 variant is pretty much affected the entire United States, including Alaska and Hawaii. So in Skokie, we've had that 1 resident, like I said. The CDC is monitoring the variants with the help of the Illinois Department of Public Health and the hospitals and the providers that are actually doing the testing. The good and the bad news is, from what I read at least, according to Dr. Fauci, and this was recently, this was as of about a week ago, he said preliminary data shows that the COVID-19 vaccines currently available in the United States should provide an adequate degree of protection against SARS-CoV-2 variants. But the big but is, however, some studies show that neutralization of the variant virus is basically, it says that the variants aren't being neutralized as much, and that the new variants aren't being neutralized as much as the old virus. So we don't know really if the vaccines truly are as effective, but they are probably still effective, even though that's the fact. And only time will tell, right? I mean, everyone always asks how effective are the vaccines. Well, it's only been a couple months here. I mean, we just started vaccinating in December. So until we really have sufficient public health data, and until we really can continue to do the testing, only time will tell. Some vaccine updates just for residents. This is where you can go to find out information about COVID-19 The Village. You can subscribe to Skokie News. You can call the COVID-19 hotline. You can email us. And we're strongly encouraging all residents to pre-register to get notified to come in. We are vaccinating everybody at this point. So anybody in any phase, we've moved on to the final phase. We've gotten through our A's, we've gotten through our B's, we've gotten through our B pluses. So we've started inviting our final phase individuals. So everybody qualifies in Skokie, and we're hoping to get to everybody we can. Some updates on our vaccine allocations. We have shared about 3,750 doses with North Shore. 400 doses were delivered to St. Francis Hospital a while back, and that's a long story, but essentially we were allocated 400 doses that we couldn't use right away just because of our clinic schedule. So we ended up giving them to St. Francis. We also, for the Moderna, 500 doses have been transferred to our federally qualified health centers. We've administered 18,280 doses through today. 12,000 first doses and 6,000 second doses. And again, we don't keep a really big inventory. I mean, we have enough doses now for next week, but, we're trying not to hold on to vaccine as much as possible. In regards to a Johnson & Johnson update, the village received 400 doses of Johnson & Johnson last week, and this week we received another 500 doses. So we have a total of 900 doses in stock of Johnson & Johnson. The village's plan is to use the Johnson & Johnson vaccine to vaccinate homebound residents, which we're starting on Monday. Homebound residents can reach out to the village of Skokie, and what we do is we place them on a waiting list. It's not very long at this point, which is good, I suppose. But what we do then is we have them register, we schedule an appointment, and either nursing staff and or the fire department will be going out to vaccinate homebound residents. And when we say homebound residents, we're defining homebound residents as are individuals who cannot leave their home in a wheelchair, in a walker, without the assistance of basically 2 or more people. So certainly we're triaging people. I think in the city of Evanston, when they opened it up, they had over 1,000 people register, and then they narrowed it down to 400 or less people, because essentially they found that 600 of those people didn't understand what homebound really meant, and that they could get out of their house and come to their clinic. Coming to our clinic is the most efficient way for us to administer vaccine. For us to send people into people's homes, we have to wait 15 minutes to 30 minutes after every dose. We can only vaccinate so many people in a day. It's just not very efficient, but we are doing it because it's necessary and it's the right thing to do. We are going to be offering a one-day Johnson & Johnson vaccine clinic. It's actually going to be on April 20th. It's not, I had it the week of something, but we actually know it's going to be April 20th. A couple of vaccine program tidbits. We are vaccinating all phases. Again, like I said, we have been out to group homes with the fire department to vaccinate group homes. We had a ton of group home staff and residents come to our clinic, but we didn't get to everybody for many reasons. So we vaccinated over 200 employees and residents at individual group homes. 28,449 residents have received at least 1 dose of vaccine in Skokie. 15,364 people are fully vaccinated. If you look at this chart, this is the percent of individuals that have been vaccinated since about, what does that say, March 10th? So if you look at that, the top line, the green line, is the percent of individuals 65 and over that have been vaccinated. So 84% of Skokie residents 65 and older have received at least 1 dose. 58% of those people 18 and over. So that's really, it is 16 and over that qualify, but since we don't have the Pfizer, I used 18. But essentially 58% of Skokie residents 18 and over have received 1 dose, and 45% of our total residents of any age have received it. So that is my presentation for tonight. And if anybody has any questions, I'd be happy to answer any questions, but don't give me those tough questions, Dr. Lynn, about variance.
No, actually, I had a comment. I again, to congratulate and extol the activity that's going on in the vaccination clinic. And it has really nothing to do with Dr. Werner and I volunteering or anyone else, but the terrific job that the staff is doing. And I get compliments all the time. So I think this is something that we should be very proud of. The only question I had, Mike, and I know that they put data out there regarding hospitalizations and stuff in terms of age groups, but I know that the 117 variant appears to be also much more aggressive in children, and we don't have a vaccine for children. And this is, I'm just curious if what data we're getting in terms of positivity, and because they're also seeing that the kids are getting sicker. It's not the asymptomatic infection that we've been lulled to believe that the pediatric population will be getting, but they're actually getting admitted and they're sicker. I just don't know what the N is in terms of the rates.
Yeah. And I haven't, Dr. Lynn, I have not seen, the state hasn't shared a ton of data with us on the variants and by age, and I don't have that data. And I haven't seen them share it on a webinar or anything, so I don't know if I have any additional information in response to your inquiry at this point. I'm sorry.
Yeah, for the board to know that my pediatric colleagues, and we meet regularly with the head of infectious disease from the University of Chicago, former Children's Hospital, but they're seeing many more admissions. And the children are sick, and they're also having this chronic inflammatory condition, which, we worry about what the long-term sequelae are. And I think maybe the public needs to know a little bit that, they have to be careful with their children now, maybe even more so, because of the variant that appears to be escalating.
Maureen, you had a question?
Well, I think, Mike, the confusion with homebound comes from Medicare criteria, and many of those people think they qualify because they qualify for home health. And so I think they're probably innocent, and your criteria is much more stringent, understandably so.
Yeah, and I agree with you. I did see the definition under Medicare and Medicaid, and it's a little bit different too.
Yeah.
Mike, are we having any data coming from the state with people, Skokie residents that are being immunized at Walgreens and Mariano's and other places?
Yeah, I do. I have all that information actually. So what I have down in my computer right now is I have data on every resident that's been vaccinated, including what vaccine they've received, whether they've received 1 or 2 doses, and which provider has done the vaccination. So, but I don't have it, I actually ran some data on that about 2 weeks ago, and I haven't updated it recently, but I mean, it's amazing. People are going all over the place to get the vaccine.
Yeah, and so the message is the numbers that you presented tonight are much better when you put all the aggregate data together.
Yeah, for sure.
There's another question?
Yeah, Dr. Warner, this is Girija. This is for the people who are, the young, we are vaccinating the older population, even in my clinic, but the younger people are the one who's not taking the vaccine, and they are the one who's partying all the time, and they are going out. I know the whole country, we focus on the senior people first, but can we make some suggestions to make sure the younger populations are the one to be targeting at faster? So when they go out to these big places and party and gatherings, they don't wear a mask, they don't get vaccinated, they don't come and give us the virus to the adults.
Yeah, I'll have to look at the data on that, because we know that we've been through 1A healthcare and people who work at long-term care facilities. We've been through 1B, that's the 65 and older. 1B plus is the 16 to 65 with underlying health conditions, and now we're at the final phase. So it'd be interesting, it would be interesting for me to look at the data to see in that final phase, like what percent of the population is within certain age ranges, and whether we just haven't gotten to them because of the fact that we kind of just opened up the final phase and are finally inviting them, or they just are unwilling to get it. It's probably a combination of both. So.
The other thing is the high school students from 16 to 19, they want it because one, they want to volunteer or they want to go to the graduation or for the starting to the college. Where can they get it? Like for the Skokie or for the Nice West High School or our school districts?
So we're actually in discussion with a local provider to see if they'd be willing to, if we gave them a list of the people who are pre-registered with us, because we allowed people 16 and 17-year-olds to pre-register. We just haven't received the Pfizer to vaccinate ourselves. So Sue Riesberg, our nursing supervisor, has actually had some conversations with a local provider that as to whether or not we can actually refer those people on our list directly to them, but nothing's finalized yet, so that's one idea. But there are, there are other locations outside of Skokie or even within Skokie that have Pfizer. It's sort of a witch hunt, right? I mean, you just have to try to find it. So, but we are working on that.
I see Cordelia is with us now.
She is.
We're a little behind schedule.
Yeah.
Mike, do you want to do the follow-up old and new business, or should we just have Cordelia do her presentation?
Yeah. Why don't we have her do her presentation? I can introduce her really quick. So first of all, I want to thank Cordelia Lutz-Gowan for being willing to spend some time tonight. I know she had another meeting right before this meeting that ended at 7:30. So, but her presentation is titled "1 Year In: The Impacts of COVID-19 from a Community Mental Health Perspective," and she's a licensed clinical social worker, and she's the manager of the intake program and a psychotherapist at Turning Point Behavioral Health Care Center in Skokie. Her areas of expertise are psychotic disorder treatment and trauma-informed care, and I'm really happy to have her here. And I think that you have the permission to share your screen, Cordelia?
Let me see. I hope I do.
Okay.
Yeah, I do. So let me get that set up. All right. I think you can see my slide. Can I get a verbal yes from anybody?
Yes,
if you can see
yes,
my
we
slide?
can.
We can see your slide.
Perfect. Okay. Thank you. And thanks for the introduction, Mike. I'm really happy to be here. So let's get started. Mike said most of this already. I got my MSW from Penn. I've worked with survivors of gun violence in Chicago and DV survivors in a shelter setting back in Philly. So currently I manage the intake program at Turning Point. In addition to managing the intake program, which includes like kind of organizing all new clients into services, I manage the wait list. I supervise clinicians and train students. I established a fellowship at Turning Point for clinicians in training who have an interest in social justice and community mental health. And finally, I have my own caseload of therapy clients. Because I'm an LCSW, I'm one of like 2 certifications that's allowed to bill Medicare for psychotherapy. It's LCSWs and PsyDs. So I see a lot of Medicare folks who live with severe mental health diagnoses, also work with couples and individuals adjusting to life stressors. So kind of the whole spectrum of mental health. So this is what I thought we'd talk about tonight. I want to give you, I know some of you are familiar with Turning Point, but I wanted to kind of talk a little bit more about it, share some trends that I've noticed in remote service utilization over the past year. I know some of you are also healthcare providers, so kind of zoom in on some case examples, what it's looked like for individuals that I work with, and then kind of open it up to a conversation about the future, discussion, any questions you have. All right. So I can see about 5 of you on my screen. Has anybody, like, just, can you do some movement if you have heard of Turning Point? Awesome. I'm seeing some people. Great. So Turning Point Behavioral Health Care Center is located in Skokie. It's been in Skokie for a long time. We just celebrated our 50 years a couple of years ago. It's right on Skokie Boulevard in Washington by Dave's Automotive and across from the Taco Bell. And we're co-located now with Heartland Health Centers. So something you may or may not know is that over 75% of our clients have some form of Medicaid. We work with people starting at age 5, and we see a range of mental health diagnoses. I think our largest group is severe and persistent mental health. So a lot of folks who have disability because of their mental health diagnosis, whether it's psychotic disorder, severe clinical depression, OCD. That's not the only group that we work with, but because of our really robust groups program, we have a lot of long-term clients who, really rely on us for support in their recovery, and also kind of have found a community and really important social support at Turning Point. So a year ago in March, we had a meeting, and I don't know if any of you had meetings at your workplaces that were like this, but it was like, well, there's this big thing called COVID. We probably don't need masks, but we're going to close for 2 weeks and go home and work from home, and we'll see you in 2 weeks. And since then, we've been working remotely, which is just hugely different from how we did services before. Everything was in person. Nobody ever worked from home, even to do paperwork. So it's been a huge shift. There's some cool things that we've done in the meantime. We have a really good working relationship with the Skokie Library, and they collaborated with us to get some computers to our not all clients, but a select number of clients, so that they could participate more fully in telehealth and have video sessions. In the intake program that I manage, transitioned from doing, previously we had walk-in hours, and so if you wanted services, you walked in during our walk-in hours, which are called open access, and you just meet with a therapist, and you'd either work with that person going forward, or after an initial assessment, you'd get put on the wait list. So we transitioned that program to telehealth, where people call in, they get kind of sent to the therapist who's on the schedule that day, and then it's a scheduled intake. And so this has been really interesting to see kind of what we have and haven't been able to do, and some things that we're doing better because of telehealth. So a lot of text on the screen. But basically, on one side, I wanted to go over kind of what I think of as the silver linings of doing this work remotely during COVID. A huge thing for me when I was in person, if it was like icy or rainy, I would know I was definitely going to have like a lunch break that day, because I would definitely have a no-show. And now, personally, I'm having 0 no-shows due to transportation or weather. You know, people are still no-showing for other reasons, but people are accessing services much more reliably. We're also seeing, so we have never had a catchment area. We would serve previously anybody who could make it into Turning Point. And when we were doing in-person services, definitely Skokie, Des Plaines, Morton Grove, Chicago, south suburbs, and far northern suburbs. The area that people are coming from now, that we're doing everything on the phone, has definitely increased. We had a week where we had several people come in from Waukegan. We had somebody from far south suburb of Madison. I don't actually know how to pronounce that because I've only driven through it, but people are making it in. And so that's, to me, a really strong positive, that we're able to work with folks regardless of where they live geographically, whether they have reliable transportation, and also for some of our clients who have mobility issues. even if they're having a pain flare, they can still get on the phone. So that's been very positive. Work schedules and childcare are less of a barrier to initiating services. People can kind of have their kid in the corner and do the intake on the phone. They're making it work. And because we're doing these scheduled phone intakes, we're seeing a higher percentage of clients who present then start services. Whereas before it might be like 8 people show up on a Monday, I have 2 therapists available. Some of those people are not going to get seen for their assessment. Now, I'm sure many of you have a good sense of what the challenges have been for us. Definitely, the population that we work with is not necessarily well connected to the internet or phone. So it's been a challenge to get folks comfortable using phone or internet, whether they had internet or even had a smartphone or computer. There's a lot less to go off of on Zoom. Even walking from the waiting room to my office with my clients, I'm picking up on, do they seem stressed? Like, is this a limp? What's going on? And now I have just this little box. So it's harder to build rapport. And I think for the clients too, it's difficult to kind of get that in-person kind of calming therapist experience because they're not seeing my whole body language. Also, for some of the folks I work with, teletherapy has been pretty triggering, especially the people I work with who have psychotic disorders. Multiple clients have expressed concern that it's being recorded or somebody else could, especially at the beginning, remember Zoom bombing? I had clients who were very concerned that somebody would come into the teletherapy session who wasn't supposed to be there. Privacy and disrupted sessions are problems for both clients and workers, navigating whether you have a private workspace in your home. And we've definitely seen childcare as a challenge for our staff as well. So just to kind of go over a few case examples, I've tried to make these as kind of anonymous and nondescript as possible, but I wanted to give you a sense of some things that I'm seeing on my own caseload. So I've definitely seen clients who've kind of expanded their skills. One of the people I work with, they received a computer from the agency, and this person probably had never used a computer before and is now fluent enough in computer to attend their groups and do video sessions with me and their case manager. And so that's fantastic. There are definitely times when it feels like progress is really stalled or people aren't, moving forward at the pace that we'd expect them to. I work with a few people who, prior to COVID, our work was kind of around overcoming agoraphobia, building motivation to socialize, get out of their house. You can imagine how validating it was to be told to please stay home for these folks. And I would say definitely the first half year of the pandemic, I had some people who were doing really well because they were just in their comfort zone. Overwhelmed families. I think I hear about this on the news every day. I live in Chicago, so the, whether Chicago Public Schools is opening or not is a big thing. We're definitely seeing school-age kids struggling because they don't have supports at school. Whether they see their school social worker or not, just there are fewer adults engaged in their lives, and these parents are trying to do it all. And finally, there is kind of different patterns around varied engagement. I definitely probably had some clients at the beginning of COVID who would have continued therapy a little bit longer, but just really struggled to connect on the phone. And also kind of needing to negotiate norms with my clients around, we're talking on the phone, but this is still a session. I had a client, an adult client actually, who I figured out was playing a video game. And so we needed to kind of discuss that and figure out why is this happening, and let's do that later. Overall, Medicaid hour is 52 minutes, but I'm seeing people who kind of run out of steam at half hour or 45 minutes. And so for me, it's worked really well just to let people wrap up when they feel kind of talked out. So as the manager of the intake program, I think a lot about like the flow of our clients, who's coming in, when are they coming in. I love looking for patterns. And so just some things I've noticed, clients who normally would kind of be coming to the end of their therapy and might end therapy and try it without therapy for a while are really reluctant to terminate services. They're hanging on to their therapist. They're pushing. We don't have limits on how many sessions we can see people, but there is kind of a natural, people will end after a certain amount of time and free up those hours for our therapists to see newer people who've come in. It's not really happening that way. After kind of the initial period of uncertainty, maybe a few months, new clients are presenting for services at a steady rate. And I'm hearing less and less like, oh, I'll do that. I'll come in when you guys are in person. Like, folks have accepted telehealth is happening and they are coming in for services. And I think a lot about the way that mental health is being centered in some of the conversations around COVID. And I think that's been a really positive thing, that people feel like it's okay to ask for support and for help. Finally, I am seeing more people with more severe symptoms, whereas before we might have a couple people a month who come in and I feel really need to see a therapist immediately because of suicidality or they've just been discharged from an inpatient psych hospitalization. We're seeing many more people in crisis. Mental health crisis and also housing has become a pretty severe issue. So if you put all these trends together, there's some clear effects at an agency and community level. So I said earlier that like over 75% of our clients have Medicaid, and they have really limited options for mental health services. There are so many therapists north of the city, in the North Shore, Chicago, and many of them who are in private practice and group practice do not take Medicaid. So what this means is that clients with Medicaid are really limited to community mental health agencies and other kind of more like nonprofit structures. And so if we're inundated, the wait times that we're seeing are disproportionately affecting Medicaid clients. Probably if anybody here has Blue Cross Blue Shield PPO or another private insurance, you could go to Psychology Today or psychology.com, find a therapist and get in by the end of the week. That is absolutely not the case for folks with Medicaid. Another thing we're seeing because of the rising demand across the board for mental health services is that a lot of hiring is happening, and the agency is in competition for the same workers with other places that have more funds to hire people, like therapists in hospital systems often get paid more. So it's creating really an issue around people waiting a long time for these really important services. All right, I zipped through that because I wanted us to have time to talk and see if you had any questions. A few questions I put up on the screen, but I'd love to hear from you if there are things that you're curious about.
Cordelia, thank you so much for this presentation. We've been talking about this and kind of had the impression that a lot of this is like an iceberg. Most of it is underneath the surface that we're not seeing right now. This has been a time of loss for a lot of people. Deaths, illness, economic, social. How do you see people grieving during this time? there are delayed funerals, kids are not in school. How are people handling that grief?
I think a good question is like, are they handling it? And something I think, we're all in this kind of crisis mode, go, go, go. And I think when things reopen, we're going to see a lot of emotional behavioral stuff happening after COVID is, in quote, over. There are people who are using therapy to mourn their losses, and then there are people who are so in the thick of just trying to survive that they don't, they can't do that right now because they'll fall apart, and they have to work and take care of their kids.
Thank you. Other questions for Cordelia?
This is Mike, Charlie, and I just had a question about why aren't private providers accepting Medicaid? Like, is it that they pay less, or is it just because they don't want to, it's just too much of a hassle, or what is it?
This is like, you're asking the community social worker, so I have some judgment about this. I just like to acknowledge. Medicaid does pay less. The pay rates have gone up over the years, and also I think under Governor Pritzker, it's gotten a lot better. They pay less than private insurance. They don't always pay punctually, and there can be a lot of Medicaid like rules that you have to follow. You have to submit kind of an assessment every 6 months. Whereas if you're in private practice, you rarely even have to send like Blue Cross Blue Shield your notes. So it's a lot more rules, and yeah. And I want to add to that. I didn't say this, but a really lovely thing about Turning Point, we have all these services under one roof. We have really robust crisis support. So for people who are, frequently hospitalized, it's a really good place to be. If you're a therapist and you rent an office, you're on your own, you're not really doing like the 24/7 crisis. So we just have a lot more support services. So we do, even for people with private insurance, we do sometimes get referrals from private practice therapists who feel that their client needs a higher level of support at the outpatient level.
And I just wanted to mention for the group that, so we have the Health and Human Services Department, and at least as of last fall, we've consolidated the Health and Human Services. And I know just from being here a couple months now that the two social workers that work within the Human Services Division have a really good relationship with Turning Point. And when we identify people who maybe have services, Turning Point is one of those organizations that we try to link those people to. And, I've only heard really positive things about Turning Point from both Iris Barrios and Brian McHugh, two staff members in Human Services. So I know it's a great organization.
Cordelia, is there something that the Skokie Board of Health can do to, I don't want to use the word promote, but somehow collaborate with you, as Mike has been talking about in terms of some of the social services, but also other mental health services?
That's a great question. I guess I don't really know kind of the scope of what you all do. I think there's always room for collaboration, especially something I'm curious about. I think I kind of mentioned this, is just continuing to have an awareness and putting importance on mental health after things reopen from COVID, because this is really a deeply traumatic and horrible experience, and people are going to need support for years to come. So just kind of keeping an eye on that as you plan, the different things that you do, including mental health, because it's it's not a mental or physical health question, right? They're deeply connected.
All right, other questions, comments? Seeing none, again, I just want to thank you so much for your being with us tonight, and maybe when we get into the recovery phase of this whole thing, you can come back and tell us about your experience. Yeah.
Yeah, I'd love to. Thank you for having me, and thank you all for your work. And thanks for, I got vaccinated with Skokie, so thank you for that.
Hopefully it was a good experience.
It was great. It was a very happy day.
Good, good. I call that the happiest place on earth. We have so many happy people, grateful people.
It was incredible. It was also the most people I've been around in like a year. So it was a little overwhelming, but it was great.
So again, thank you.
Thanks.
We'll move on to the agenda. Mike, do you want to just cover the old and new items?
Yeah, I have one or two more things here. Let me just, I got a juggle on my screen here. Just give me 1 second here, Dr. Warner. I did want to share one more thing with the group. So I know that, as you all might have remembered, I can't remember, I think it was at the March meeting, Dr. Warner had drafted this wonderful resolution that essentially thanked the village and the health department for everything they were doing with the COVID-19 vaccine campaign and COVID-19 in general. And I shared that with the village manager's office and the mayor. And in return, the mayor issued this proclamation on Monday. And I'm not going to read it all, but essentially what it does is it thanks, essentially they plagiarized what Bill had done, what Dr. Warner had done, and then just said that now therefore I, George Van Dusen, the mayor, of course, do hereby proclaim the week of April 5th through 11th as National Public Health Week. But all the whereas above it are exactly pretty much what Dr. Warner had drafted. So I just wanted to make sure the group knew that I did share it with the mayor, and the mayor took that and ran with it and used it for his proclamation he issued. So I want to thank Dr. Warner for the wonderful job he did with that, and the Board of Health for recommending that it be shared with the mayor and the village manager.
Well, and thank you for advancing this.
Yeah, and then the only other item I have is the E-Cigarette Ordinance, and I don't have any updates, Dr. Warner. I think what I had mentioned last time is either late spring or early summer is when the village manager said it would go to the board. So that's the only updates I have, remaining updates I have for tonight. Thank you.
Okay, and any citizen comments that have come in?
No, I'm not aware of any citizen comments that have come in, Dr. Warner.
Okay, Pat, you have your hand up?
Yes, I have one question, whether anybody has heard anything about COVID connected with public swimming pools.
I haven't. I mean,
I haven't heard that, no.
And two, a suggestion that if members of the board have some free time on Friday afternoon and on Monday morning, a group meets at the village hall to open syringes and put needles on them in preparation for the sessions on Wednesday and Thursday. Those are seated at a table events, and it's about 3 hours. It's very important to have these things prepared ahead of time, and it's a job that a person can do in comfort without a lot of people and a lot of stress. And if you feel that you could do this to assist, call Jen Davis at the department and offer to volunteer.
Okay. All right.
Thanks for mentioning that. And I said, thanks for mentioning that. And occasionally we even give the volunteers free pizza, but just rare, I would say rarely, but it does happen. So you never know what you're going to get when you come in and volunteer.
Okay, well, there are no public comments, then we're at the end of the agenda. So I don't know if we're official or unofficially closed for business, adjourned.
Okay, thank you guys, and thank you for our guest speaker, if she's still here. She might have jumped off.
Thank you.
Okay, thanks everybody, and sorry for the technical difficulties in the beginning.
All right, thanks.
Okay,
See you all
thanks.
next month.